how do you know if you're actually in perimenopause or menopause? A lot of women think that they need to get their hormones tested. I got to get my blood levels tested. Or some of you might even know something called the Dutch test, which is where you do pee samples. So the research shows we should stop doing this, ladies. A lot of you out there who are going to maybe more expensive functional medicine doctors are getting these tests done. And I just want you to know the research doesn't support it. And it's just a way for us to make a lot of money off of you is what it is. So I really want you to hear me right now for what the research indicates is the best way for you to know if you're in this stage. What we know is that around age 45 is when we hit, perimenopause, and that is when our estrogen and our progesterone are going all over the place. What we find though, when we track the hormone levels for women is that some women have very high levels of estrogen during this stage, some have normal, and some have really low. So looking at hormone levels is not a good predictive factor of whether you do or do not need to be using hormone replacement therapy, or a more accurate term for what we should be calling it is menopause hormone therapy, so MHT. Hormone replacement therapy should really be a term used for if you're before age 45. So this is going to be like women who are dealing with menopausal type symptoms or going through menopause or perimenopause prior to the age of 45, because that's actually very early onset, and that's not typical. So if it's something that's happening before age 45, then we do want to get blood work done. Maybe we do want to do the Dutch test because we want to see what's going on. And then hormone replacement therapy is indicated. But 45 is when typical perimenopause starts. Age 51 is when menopause is average age for us as women, and that's when our estrogen and our progesterone plummets. So what do we need to look for? How do I know whether I'm actually entering into this phase? The best predictive factor is the length of time between your periods. And what's so cool is I don't need to go to a fancy doctor. I don't need to do a fancy test. I don't need to spend any money on this. All I need to do is go on my phone and download an app that tracks my period. And so what we know is it's normal to have about a 7-day difference between your cycles. That's normal. So for instance, if I have a period and there's about 24 days between it, and the next time I have a period and there's about 30 days between it, that's okay, because that's a 6-day difference. Okay, so 7 days difference between periods is considered normal. Now, when I start to consistently have more than 7-day difference between my menstrual cycles, that's when we're starting to enter into perimenopause. When I now have a 60-day gap between my menstrual cycles, that is a really good predictive factor that I'm going to enter into menopause within about 1 to 3 years from that time frame. So the best way to know whether I'm in menopause or perimenopause is to track my menstrual cycle and to look at the days between my cycles. Not my hormone levels, not by going to a fancy doctor, not by doing fancy tests and having them interpreted. So I just saved you a bunch of money. Download those apps, start tracking, and if you're having any symptoms of perimenopause and menopause, like hot flashes or genital urinary syndrome of menopause, which is where your vulvar tissues are dry, you're feeling irritated, pain with sex, more infections like UTIs or BV or yeast infections, talk to your doctor and get yourself on vaginal estrogen now.